What happens when someone dies during the continuing healthcare process? When someone dies during the continuing healthcare, CHC assessment, or funding process, several things happen depending on the stage of the process and whether funding had already been approved. Here's a breakdown of what typically happens. If the person dies before the assessment is complete, assessment stops. The CHC assessment process will stop. Retrospective review may occur. The family or representatives can request a retrospective assessment to determine if the person would have been eligible for CHC funding before death. Possible reimbursement. If the retrospective assessment finds that the person was eligible, the NHS may reimburse care costs paid during the relevant period. If the person dies after being found eligible but before funding starts. Backdated payments. CHC funding may be backdated to the date eligibility was agreed, and the estate may be reimbursed for any qualifying care costs incurred in the interim. If the person was already receiving CHC funding, funding ends. CHC funding stops on the date of death. Final accounting. Care providers may submit final invoices to the NHS. Important considerations. Notification. The NHS or CHC team should be notified of the death as soon as possible. Documentation. Keep thorough records of all care costs, correspondence, and decisions during the process. Appeals. If you believe there was an error or delay that affected the process or resulted in unfair costs, you can appeal or request a review. Please share your thoughts in the comment section below.